The Modi government, which came to power promising increase in access to health, free medicines and lower care costs, has done little to keep his promises. Since Modi government came to power, there has been a 20% cut in the budgets for National Health Mission and a 10% cut in the allocation for Integrated Child Development Services program. The government's health budget for the past 3 years has been hovering around the Rs 33,000 crore figure, and the current budget stands at 1.2% of the GDP. India's public health spending is among the lowest compared to other low and middle income countries like China 3% and Brazil's 4.1%.
Bigger problem with the health sector really is one of figuring out what the appropriate policy and pathway ought to be, and how one can address some of the major loopholes in India's public health system, which is a combination of access and quality provision of care. The government in its early days had announced that it would launch a national health policy. It had talked about merging the National Health Mission into something called a National Health Assurance Mission. The BJP's manifesto had talked about a right to health. The National Health Policy made its way into the public domain sometime early this year and has been opened up for comments. It's a fairly flawed policy. There are many problems with it. However, suddenly it's disappeared from the public discourse and we don't know what's happening. I believe the minister, in his response to the demand for grants debate, claims that there will be something that will be coming up soon, but we haven't yet seen it. And the National Health Assurance Mission has also sort of disappeared without a trace.
Meanwhile, the decision to set up the Ayush Ministry, exclusively dedicated to promotion of traditional Indian medicine, received a lot of criticism from the medical community, especially since the move coincided with the government merging the Department of AIDS Control with the Health Ministry, in keeping with their election slogan, Minimum Government, Maximum Governance.
And it goes back to the question of whether this is going to be driven by the center or is this going to be driven by the states, because for the moment the National Health Mission falls into the category B programs that were announced in the budget, which is going to be partially funded for this next year and perhaps over time moved entirely to states. So we really don't know what's going to happen.